Hi, this is Sarah Meixel with the Dairy Site, and today we're here with Dr. Sébastien Buczinski. He is a professor of veterinary medicine at the University of Montreal. Thanks for being with us today, Sébastien.
Thanks, it's a pleasure to be here.
Very good. And today, Sébastien and I are in Madison, Wisconsin at the university here at the Smart Calf Rearing Conference. And you spoke today, Sébastien, to the audience. We just got done hearing your talk. Tell me a little bit about your message. And you started out by talking about benchmarking and kind of comparing your dairy calf farm to neighboring farms and the benefits involved.
Yes, it's always a challenge to compare different herds having different kinds of disease, different prevalence of those diseases like bronchopneumonia, diarrhea, or mortality. So it's not easy to know if my herd has better performance or worse performance than the other herds. So the idea with the project was to be able to put all the health indicators, including morbidity and mortality, on the same scale that could allow us to compare herds, and within the herds knowing the main problems associated with losses of health in their calves.
Very good. And you started out with some discussion about human health and used kind of a human health model to do this, correct?
Yes, actually, we applied a methodology that has been used by the World Health Organization and the global burden of disease to compare population. So basically, they record the health problems in the different population and mortality and the causes of mortality and diseases, and they put with a mathematical equation everything on the same indicator, which is what we call the DALY, Disability Adjusted Life Years.
And explain what that really means.
So shortly, the DALY is the losses of healthy life you have in a population. So you can either lose some healthy life due to disease. When you are sick, your life is not easy.
Yeah.
But also if you are dying before your expected age of experience of life.
Very good. And then you related that now to the dairy calves.
Yes, so actually we conducted a study in 40 dairy farms around the Quebec area where we applied this method from the human side to the calves to be able to have like the calf DALY system that combines losses of health due to the main diseases and also due to mortality. To be able to have in one indicator, the DALY, per 10 calves calving, summary that could be compared from a farm to another. So after that, people can know where they are and also why they are in a good or in a bad position and how to improve calf health in their herd.
From there. And ultimately, you were talking about really kind of getting it down to the core problems that a producer really needs to focus on, right?
Yeah, definitely. This is one of the powerful, the power of the DALY is that it is not only a number, but you can see where the main losses of the numbers, what is the most important. So if it's mortality in my herd, that makes the most high impact on the DALY. This is where these herds need to work.
Right.
And when it's the losses are associated with morbidity, you can dig into the main cause of years lived with disability and the main morbidity problem in that herd.
Right. And I guess what are the key takeaways from a producer, a calf producer and their veterinarian for this kind of information?
One of the take-home is the importance of recording data for the calves because we can put value in those data using such benchmarking indicators. So with that information, the producers can compare himself with other neighbor farms. So this is something that can be achievable in terms of improvement because one of the main difficulty we have when we say, okay, the objective is that,
Right.
but they say, okay, but it's an objective. I don't know if I can achieve it, but okay, your neighbor can do it. So you
Right.
can do it. Why don't you do it? Your
Right.
neighbor can do it. So this is the take-home.
Right, and that's true for. I mean, you can't change what you can't measure, right?
Yes, definitely. And it was one of the challenge we have with that study, because a lot of the participating producers have had a recording system, but data entry was very irregular. So we could not use only this recording system, and we use veterinary visits to be able to gather the most information on the calves. So my other take home is to record data on calves, because it helps in the end to improve calf health and profitability of the farm in the long term.
Right, and data is really the name of the game, right? I mean, not just in the dairy industry, across all livestock species, we see that, right? The industry has changed and data has become so important.
Yes, definitely. I always told to my students, without data, you're just another person with an opinion.
Right.
So for me, it's very important to
Right.
base our decision based on data.
Very good. Excellent. Well, thank you so much for all the information today, Sébastien. I really enjoyed your presentation.
It was a pleasure. Thank you.
This is Sarah Mikesell with the Dairy Site.